Hi everyone, it's Linda from Be Clear with Bronchiectasis. I hope you're doing well today. Today we're going to be discussing oral hygiene. I've discussed toothbrushes and sterilizing toothbrushes in the past, but now we're just going to expand the discussion a bit and talk about overall oral hygiene. Most importantly is that those of us who have bronchiectasis, who have lung disease, be sure to take good care of our mouths. So, what does that mean? That means going to the dentist regularly, having your teeth cleaned, and taking care of any issues. Because very often issues can breed bacteria, and we're trying to prevent bacteria from, especially the bad bacteria, from going into our lungs. So the mouth is really fascinating. It was thought to be sterile until recently, not too long ago, and now they've identified over 600 different types of bacteria in the mouth. Many of them are thought to be harmless, but now there's a lot of research being done on, in fact, just that, because they're finding that some bacteria that they thought were harmless make their way into the lungs and can then disrupt the microbiome. This is called dysbiosis. So lots of exciting research, and there's nothing for us to do as far as using strong mouthwashes or anything of that nature. They don't really know which ones are the good bacteria, which ones are the bad bacteria, which ones are sort of don't do much of anything. So rather than that, certainly going to the dentist regularly is very important. And this comes up often in discussion groups, that there's fears associated with going to the dentist, and understandably so. I mean, first of all, we're put in that chair, our head is back, our feet are up, and that's going to make most of us, or many of us, cough. And it just becomes very unpleasant when you have to try to suppress a cough. Your dentist or your dental hygienist is working on your mouth. It's not an easy situation. So I make a few recommendations, and one is just good communication. So tell your dentist and your dental hygienist, look, I have a lung condition, and if you put me back, way far back, I'm going to probably cough. So perhaps you don't have to put me back this far. Is that an option? Or something that I like to do is I let them know that if I hold up my finger, that means I have the urge to cough, and I need to turn my head away from them so that I don't cough in their face. So good communication is certainly number one. I've also had the conversation with them regarding water. I prefer to bring my own water, my bottled spring water, to rinse my mouth out and not use the water that's in their woozy woozy. I don't use that, or in that. Oh no, that takes saliva out. That's okay. But I don't like to use the water that comes from that spit, spittoon, for lack of a better word. So I bring my own water. Also, my dental hygienist has agreed to do a manual cleaning on me whenever I go. So rather than use the Cavitron, which squirts water to clean, she does a manual scraping and cleaning. And I feel my teeth are very clean when I come out. I never feel that perhaps I got a lesser job. And that's our understanding. No Cavitron. I bring my own water. And if there's a situation where the dentist for some reason, has to rinse your mouth out, I mean, he does have, or she does have sterile water there. I think they have 9% saline for different types of procedures. So that's all about the dentist. And you also might want to clear airways before you go so that you're less likely to need to cough. And perhaps not eat right before, because if you're going to be put back in that chair, it could cause reflux. So let's say you've got the perfect mouth now, and you come home and you want to maintain it. Well, certainly brushing your teeth is important. And my dentist says for 2 minutes. That seems like an awful long time, but I'm trying to follow along. What I do, and this has been, I don't know, I've had this procedure in place for about a year or so, I think, is I have this container in my cabinet with multiple toothbrushes. I probably have a half dozen of them. Here I have four because two are already in my dirty, what I call my dirty bin. And I also use a tongue scraper. It's something I use. I don't know if it's something you'd be interested in. But I use my toothbrush for a couple of days, and in between brushings, I just put a little drop of dish soap on the toothbrush head, rub it in, and then rinse it off. And then I let my toothbrush air dry. And then before I use it, I have this little UV device called a Brill. And so I put my toothbrush in, close it, and it turns blue. Can you see that? And supposedly it's working. You could put your toothbrush in right after you use it, but they say not to put in a wet toothbrush because obviously when you have a closed space with dampness, you can breathe bacteria, I guess. So this is a great little gizmo, especially when traveling. Other times, because I have a large UV baby bottle sterilizer that I had from years ago when I used to boil my airway clearance devices and then dry them in that baby bottle sterilizer, I sometimes put my toothbrushes in there. So that's pretty much how I maintain my toothbrushes. I mean, I use my toothbrush just for a couple of days and I throw it in my dirty bin. That's my little procedure, but maybe it wouldn't work for you. And then I use another toothbrush, and then when I do my airway clearance devices and sterilize them, I sterilize my toothbrushes right along with it. So I always have a very clean toothbrush. And when we think that, you know, we've been told with toothbrushes, I guess change them every 3 months or so, you know, it can breed stuff. I mean, there was a study done with children in Ireland who have cystic fibrosis and also had Pseudomonas. And what the researchers did is they cultured their toilet bowl and they also cultured their toothbrushes. And lo and behold, they found the same isolate of Pseudomonas on both. So at a minimum, put your toilet seat down before you flush. Sometimes you don't have control. If you have a bathroom that you're sharing with others, that could be a little problematic. So just put your toothbrush away. Don't leave it in a family cup. Put it away. Try to keep it dry, and then use a new one every so often. What else do we want to talk about? Well, some of us have these lovely retainers for our mouth because our teeth are shifting. And so how do we clean these? And before getting my retainers, I talked to the dentist, and he knows my concerns. He definitely knows my concerns. And he suggested this tablet called Retainer Break. So after I take my brush, my retainers out, I give them a quick brush with my toothbrush, and then I pop them into a paper cup of water with this tablet that turns blue and it's fizzing and doing its stuff. And then after that procedure's over, I do dry these. I dry them with a paper towel. And then I either stick them in my UV sterilizer or in this little device. Now, with a UV sterilizer, you have to be careful not to put the dry cycle on. If you want to just hit them with some UV rays, that's one thing, and it's very good for that. But do not put the dry cycle on, okay? It will not end well. So, but this is a great little gizmo for traveling fresh night. And just like the just like the toothbrush UV sterilizer, this is a retainer UV sterilizer, and you press this. Oh, it did come on. It seems like with technical stuff, they don't want to cooperate. But you can see it's now working. So these are suggestions I have on maintaining good oral hygiene. Okay, thank you so much. I hope this was helpful. Please like this video and subscribe to my YouTube channel. Take care. Bye-bye.